Mrs. Endicott's next.
Oh, great. Yeah, just put the message by my bag, Kath. I'll deal with it later, okay?
Okay.
Well, Kath, that reminds me. I got caught by Mrs. Endicott in the supermarket the other day. Wanted to know why she couldn't get through on the phone. I then had the same 10 minutes later from Roy Gilbert in the post office. Look, it's really important that our patients can get through to speak to someone at the practice, okay? Can you send Mrs. Endicott in, please?
I'll fetch her.
Hello, Mrs. Jackson. Sorry to keep you waiting. How can I help?
My little Elizabeth. Elizabeth Groves. Here for 4 teeth out with Dr. Chalmers. Going to have braces.
Grant, my name is Liz Groves, and I'm not your little anything, alright?
Perhaps I should call her LG like her friends do. They're all so cool. Not so cool when they've to come and have some teeth out. She should have had these out a couple of weeks ago, but got a headache. Actually, I think it was an excuse because she was a little bit scared.
Yes, well, you're in good time. Please, have a seat and fill in this medical history form.
Thank you. All right, come on, sit down. Why do you treat me like a baby? Oh, don't be so silly. Right, I'm going to fill this form in for you now.
Hello, how can I help?
Hello there. I've got a series of appointments with a Dr. Nelson. I'm going to need to change them all. You see, my boss has got me a job working away for 3 months, and I'll be leaving this weekend. I've been trying to get through on the phone to sort it.
Yes, I got your message this morning.
Well, I've left a few messages, and I've been trying all week.
Well, that's the first one that I've received. I'm not sure what happened to the other ones.
Well, I have left them. Look, I don't think I should be here. Now, is there any way that we can sort this out quickly?
Elizabeth, are you all right? I'll get some help. I'll get some help. Excuse me. I just need some help.
I don't know, make a special effort to come here because you can't get through on the phone, and then I'm standing here watching somebody on the phone. How ironic. It's ridiculous. I don't know why I bother. If my boss knew I was in here, I'd get it in the neck.
Excuse me, Elizabeth really doesn't...
Do you mind if I was here first?
Okay, now where were we?
My appointments.
Mrs. Jackson, are you okay?
No, I'm not okay. Elizabeth needs some help. She's having an asthma attack.
Excuse me, I'm going to have to deal with a patient with breathing problems.
What? You can't get through on the phone? You can't get through when you make a special effort to get here? What kind of service is this?
I've got your number. I'll ring you later.
I'll wait.
Just breathe. Oh, she's got asthma. I'm not sure about the inhaler. I don't know what to do.
Keep calm. Liz, I'm going to go and get help. I'll get Dr. Chalmers. Mrs. Jackson, stay with Liz. I'll be back as soon as I can.
Okay, thanks. Just breathe.
Are you sure Mike can't come?
Mrs. E's really testing his charm skills. Not helping that he's in a grump today.
Shall I ask John? He's in surgery too.
No, well, yeah, that's probably for the best. He'll know what to do. You get John in the emergency kit. I'll stay with Mike and help keep Mrs. E sweet. Any problems, come and get one of us.
Okay. I'm just going to put this probe on your finger.
Here, have some more of this. It makes you feel better. I'm just trying to help you.
Here's Dr. Nelson.
Hello, I'm Dr. Nelson. What seems to be the problem?
Well, she's having an asthma attack. Shouldn't you call an ambulance?
I'm sure that we can deal with this. We can soon get Liz more comfortable. How are you feeling? You need some salbutamol, that will help.
Liz has used your inhaler. I've checked it. It isn't empty and it's in date.
Okay, let's use our inhaler with the spacer.
Here, it's not activated. I've got the asthma page open in the manual and the peak flow meter's ready to use. Do you want that first?
No need. Get the oxygen set up. That will help with the breathing too.
What sort of mask?
Yes, with a mask. Thank you. This will help. I'm going to hold this over your face. Take a deep breath in when I say. Come on, this will make you better.
Can you hold Liz's hands, please? It's not working. Did you activate it?
No, I told you I hadn't.
Do you know what you're doing?
Yes. Please stay calm. Let's try again. Hold the hands again. Hold your breath. Oh, come on, you've got to help yourself.
What's happening? What are you doing to my Elizabeth? She only came here for a few teeth out. Call an ambulance.
She's having a fit, that's what's going on.
Thank you, I can see what's going on.
Well, who's calling the
I've
ambulance?
seen this before, she doesn't need an ambulance. My mate has fits like this, his arms are the same thing. His legs are all over the place. Not like hers are all floppy. Oh, I don't know, what do I know? Maybe there's different types of fits.
Shut up, will you? How can I think?
Hey, don't talk to me like that.
I'm sorry, all right?
Look, stop squabbling. Find me a telephone. I'll make the call for an ambulance.
She doesn't need one, the fit will stop.
Please be quiet. Kath, get the oxygen on full flow.
The fit began about 7 minutes past. That's 2 minutes ago.
Call an ambulance. Suspected status epilepticus. Then get me an intravenous cannula and some midazolam from the surgery.
But I don't have the keys. I'll have to get Gina.
Whatever. She needs midazolam now.
Well, there's some buccal midazolam here. Let that do.
No, intravenous will be much better. Just do as I tell you. Call an ambulance. Suspected status epilepticus. Then get me an intravenous cannula and some midazolam from the surgery.
Mrs. Jackson, let me come in there, please. You go with Kath.
I think that she's in status. It started with some sort of asthma attack.
Okay, thanks. Liz, it's Mike Chalmers here. I'm just going to take this mask off for now. There we go. You are safe, Liz, okay? Just need to do a few simple checks. Okay, Liz, just open an eye so that I know you can hear me. Good. Well done. Well done. You're doing really well. Let's start to work together with your breathing, okay? So you just follow me, Liz. Just follow me. Nice and calm. Nice and calm. Okay, here we go. Good. Good. Well done. You're doing really, really